Hi Lindsay, this is Dr. Roy. This is the video that I had promised. It will help you see a little bit better or provide some clarity on what we're trying to do trying to do with your treatment. So this is where you are now. This program is called ClinCheck, and it allows us to look at your teeth in all dimensions. We can look at single arches, we can look at different angles, and we can also look at what Invisalign is planning to do. But before I start, I always want to let patients know that this is what the computer thinks your biology can do. Obviously, there's a large variation from person to person when it comes to how easily or how difficult teeth move. Therefore, the computer is estimating the average person's biology, therefore creating a treatment plan based on that fact. What does that mean? Sometimes we don't see the movements that we are expecting. Therefore, it's not uncommon, and I would expect that we're going to have to do another scan, sometimes multiple scans, and order a new set of trays because the trays that are fabricated are based upon this computer model. It's very good, but it's not perfect. All right, so what we see here in the treatment proposition isn't necessarily what we're going to see. I don't expect you to fully understand everything that I'm planning based upon that fact, but I'm building in what I think your biology is going to be based upon who you are, your age, so on and so forth. And I'm going to have the computer make trays according to what my estimated assessment is of your biology. Okay? So basically, the treatment objective for you isn't so much that the teeth need to be straightened. When people normally think of braces or orthodontics, they think about making things look better. But like you and I spoke about on the phone yesterday, your case is so much more about function. What do we mean? When the teeth come together, we like them more or less to all hit at the same time. Okay? As you can see, you have a very significant anterior open bite. We'll get to why that might be soon, but I just want to show you a tool that we have. It's called occlusion. And let's look at the lower arch. This is where your teeth are coming into contact. It's only hitting the back teeth. If your muscles prefer to have all of your teeth touch at the same time, this is not very good. The goal here is to get blue contact points all the way around, at least all the way to the canine, and get the front teeth closer together. When the muscles notice this kind of situation, they often have a difficult time with it. I like to use the analogy: if you stood on one foot for a long time, that's not normal, and your muscles eventually would get tired. The knee of the leg that you're standing on might have some issues. You know, that's no different than the TMJ, the joint, having issues as a result of the muscles not being happy. These contact points have created a dysfunction in your system. That dysfunction has manifested itself into the problems that you've experienced. Now, why did this happen? Well, like you and I spoke about yesterday, your tonsils were removed. I think this was a manifestation of your tongue not being happy because you couldn't breathe very well because of the tonsils and the adenoids being enlarged. Happy to hear they were removed 2 years ago. But most of your life you had that problem, and your tongue most likely was thrusting forward, pushing these upper teeth farther out than the lower teeth, and as a result created an overjet or an open bite. We see these kinds of problems, open bites, in patients with breathing problems, which is why I wanted you to have the sleep study. Although I'm very confident that the removal of the tonsils most likely treated any pre-existing problem, I still want to make sure that we don't have any remnant problem left over, because how I treat this case is highly dependent upon whether you can currently breathe well or not. Okay? So I'm glad that you had those removed. If you hadn't, this treatment plan would be very different. It would be a lot longer. But now that you most likely can breathe much better, the plan will be the following. I like where your upper teeth are, more or less. Obviously, there's a couple rotations that need to be fixed. You know, these are minor problems, but I'd like to see this guy right here, that is your upper right second molar. I'd like it to come in line with the arch form a little bit better. That guy's sitting out too far, and it's a big reason why you're hitting it first. As we start to align this tooth and this tooth, naturally your bite will come together better. But I would also like to level your teeth a little bit. Let's take a look at where your teeth live in your face. Yeah, they look pretty good. I don't think there's any need for us to pull those teeth down. A lot of times what I'll do in cases like this is put elastics on the teeth and pull the upper front teeth down so that the gum tissue level is level all the way across. It's a somewhat difficult movement to do. In patients that have airway issues, it has a higher degree of relapse. The teeth look great in your mouth. Okay, so what I'm looking at is how the lips in your face sit around the teeth. I don't think we need to change anything. If we pulled these down, I don't think it would look as good as it could if we just left them where they are. I would like to bring these teeth back here up a little bit to make everything nice and level. So we have some aesthetic things to do. Again, I don't think we would do this if that was your only problem. I think your teeth look great. But if we're going to fix a functional problem, we might as well improve as much as we can the aesthetics in the direction that we like. So that's the goal on the upper arch. Like we talked about on the phone yesterday, I could bring all of these teeth in to match the lower arch, but that decreases the size of the garage for the tongue. We'll call that the palatal vault. Instead, what I'd like to do is expand the lower teeth. So take these teeth and move them out, and by doing that, allowing the back teeth to come together better so that your front teeth will come together. So let's take a look at what Invisalign has proposed. So that was their first attempt. When I say they are technicians. They're not dentists. So they more or less just line them up so they look good. Once I get the data from your sleep study, I'm going to determine how I want to resolve the rest of this. But essentially, I want to get rid of this overjet right here. To do that, I'm most likely going to have Invisalign expand your arches even more, which is going to give you an even more beautiful smile and a more functional smile, and that will help us decrease this overjet. So long story short, when we expand, meaning take the back teeth and push them towards your cheek, we improve your airway, we improve the space for your tongue. Looks more aesthetic, but it also helps to decrease this overjet. As that happens, your muscles are going to be happier, your joint is going to be happier, and we're going to track that over time. Now, the important thing is we're going to watch to see what your lower jaw does as that happens. Most people, this starts to naturally close as your lower jaw starts to relax into a better position. If that doesn't happen, or it doesn't happen to 100%, meaning as we straighten the jaws, this whole jaw will actually close this gap. The jaw arcs in a different position, more forward, which is a more airway friendly position. So we often see that happen naturally. My guess is that it'll happen a little bit, but not enough to close this space. At the end, if we decide, and you and I can have this discussion at the time, that we want to further close the space, what we would then do is very gently remove a little bit of tooth structure in between the front teeth, a little bit here, a little bit here. It's a very small amount. It does not pose any problems to the teeth long term. But what that does, it allows us to then further close this space here. So there's more things that we're going to have to talk about down the road. I just want to prepare you for that. Nothing bad, nothing that you need to worry about. These are just conversations that we're going to have after we've seen how well your teeth move. Okay? So that's pretty much the gist of it. The number of trays that you have here is 14. Your case is going to be, if we want to do this right, I would plan on 1.5 years. plus or minus 3 to 4 months. I know that may seem like a long time, but the health of your jaw joint is going to be so much better over the rest of your life as a result of this. I can't tell you how many patients we see in their 60s and 70s that come in with fallout from having a bad system. They lived their whole life with the problems. The dentist that they had didn't have the tools necessary to solve their problems or the knowledge, and the patients just thought that was normal, and they went throughout their life going to the dentist every other week with broken teeth, fractured teeth, saw jaw joints, and so on and so forth. We're going to prevent all of that from happening. I'm super confident that this is something that's going to improve your quality of life dramatically. It's going to be some work during the Invisalign time, but we can definitely walk you right through that. All right, so that's pretty much it. The last thing I will show you are the attachments. They're not red in your mouth. They'll be tooth colored. Nobody's going to see them. But these are some of the positions of where they're going to be. I wouldn't worry about these at all. Patients do very well with the buttons. After we're done with them, we then remove them. Doesn't cause any damage to the teeth. All right, so that's about it. I will let you know once I'm done the clin check. I'm going to wait until you're done with the sleep study. I'll have Ray reach out. We'll get that information in. In the meantime, I'll be detailing this clin check treatment proposal, and then I'll hit send once I get the sleep information. Probably a week later, the trays will be in. So I would say the next 3 to 4 weeks we should be good. The last thing I will say is patients who go in Invisalign that have pre-existing TMJ problems, sometimes the Invisalign can cause an exacerbation of problems. I would say it happens about 5 to 10% of the time. I do think you're at slightly higher risk based upon your symptoms. If that happens, I know exactly what to do. We'll get you out of it. Basically, I'll walk you through if and when that happens. I have a bunch of tools in the toolbox to solve those problems. I just want to let you know, I wouldn't want you to think that the Invisalign made things worse, and I wasn't prepared for that. I'm prepared for any inevitability. It's just a matter of seeing how your body responds once we start the process. Sometimes it gets worse before it gets better, but I'll be there every step of the way. All right, Lindsay, hope this helps, and look forward to Ray reaching out to you to get your sleep study. All right, take care.